My name is Tim Embree. I'm from St. Louis, Missouri. I served 2 combat tours in Iraq with the United States Marine Corps Reserve. This legislation being considered today will finally affect veterans of all generations and their families. We appreciate this opportunity to offer our feedback. IAVA proudly supports the Improved VA Outreach Act of 2010. Too many men and women discharging from the military are not enrolling in the Department of Veteran Affairs for their well-earned benefits. Currently, the burden is on the veteran to seek out their benefits within a passive VA. This is unacceptable. The VA must develop a relationship with the service members while they're still in the military, not after the service member have traded their uniform for a t-shirt and blue jeans. The VA should learn from successful college alumni associations. Those folks do not wait until graduation day to find their newest members. They greet them on the first day of freshman year and repeatedly engage them throughout their education with planned activities and social events. The VA should do the same. They should greet service members once they complete basic training and build on that relationship throughout the service member's time in uniform. When a person leaves the service, the VA should create a regular means of communicating with them about events, new programs, and opportunities. The VA must aggressively promote VA programs to veterans who have not yet accessed their Department of Veteran Affairs benefits. If I got half as many letters and emails from the VA as I do from my college alumni association, that'd be a good start. To transform the VA from reactive to proactive, IAVA believes the Department of Veteran Affairs must invest in aggressive, modern, and innovative outreach. This is not happening now, and veterans are clearly suffering as a result. IAVA was disappointed when there were only a few brief mentions of outreach activities in the President's VA budget submission, none of which were for a dedicated outreach campaign. We believe the VA budget must include a distinct line item for outreach within each VA appropriation account. This line item should fund outreach programs such as the OIF/OEF outreach coordinators, mobile event centers, and the VA's new social media presence on Facebook and Twitter. The VA's current outreach campaign is disappointing. When the VA announced it had placed ads on more than 21,000 buses nationally in order to spread the word about the Suicide Prevention Lifeline, we were initially enthusiastic. But then we saw the ad. We saw another missed opportunity. The VA bus ad had over 30 small print words. The average bus ad was limited to 5 to 10 words. In the short time when a bus passes, a veteran would have to go by the bus repeatedly to even read the hotline number. IAVA is run one of the largest non-governmental outreach campaigns in history. We have partnered with the Ad Council and some of the world's best advertising firms. We have learned a lot about the best ways to communicate complex and serious issues through television and print. And we are ready to work with the VA to share our expertise. The Improved VA Outreach Act will help the VA take their current outreach efforts to a whole new level. This bill requires the VA to effectively coordinate outreach efforts among the different parts of the department, as well as other agencies offering services to returning service members, to work closely with the Department of Health and Human Services in order to promote community health centers. These community health centers may be the only medical facility a rural vet can reasonably access without spending a full day riding in a car or bus. To set up an outreach committee tasked with coordinating efforts, which currently are being done on an ad hoc basis among the many of the VA's separate departments, and to submit a 2-year plan fully explaining their outreach activities. To bring America's next generation of veterans into the VA to receive the benefits they have earned will require an unprecedented VA outreach program. The Improved VA Outreach Act of 2010 is the first step in getting us there. Stories about veterans leaving VA facilities sicker than when they entered cast a cloud over the confidence veterans place in the system charged with their care. Therefore, IAVA endorses H.R. 4062, the Veterans Health and Radiation Safety Act. Improper use of medical equipment, especially radioactive isotopes, can lead to unexplained illness, cancer, and even death. The VA was recently issued the second largest fine by the Nuclear Regulatory Commission for misuse of radioactive isotopes in the treatment of nearly 100 veterans in Philadelphia. H.R. 4062 mandates the proper oversight of these treatments so veterans can be confident in the safety of the care they receive. It is common sense to support our Gold Star parents, who have given so much for our nation. That is why IAVA supports H.R. 4505. This bill expands access for Gold Star parents to state nursing homes. H.R. 4505 changes the requirements to include Gold Star family members who have no remaining sons or daughters but have lost one of their children in service to their country. IAVA is proud to continue working with this committee on the many issues facing today's veterans. Thank you very much for your time today, and I look forward to answering any questions you may have.